The next session is one that's called Finding Joy in Sex, Addressing the Pleasure Deficit in Discourses of Sexual and Reproductive Health in Africa. And in this session, we now have about 35 minutes for the session. And there are 3 speakers, and unfortunately, Moses Kafulu couldn't make it. And so Chisomo Kalinga will start by reading a piece of his, and this will be followed by Angelique Thomas, and then we'll go back to Chisomo. There will be a discussion, and I had some questions for the speakers, but I might actually open it up to the audience, and if there are no questions from the audience, I'll jump in with my own questions. So before we begin, let me just read the bios of the speakers. Angelique is a social science researcher who's actually worked on a wide range of research settings, and these have included universities, NGOs, as well as large-scale clinical trials. She's currently a doctoral fellow at the Institute for Humanities in Africa, and she's also a qualitative researcher at the Center for Social Science Research. And her PhD which is in the Department of Anthropology at the University of Cape Town, focuses on the sexual and reproductive health resilience of young women living with HIV in South Africa. Chisomo Kalinga is a Wellcome Trust funded medical humanities postdoc fellow at the Department of Social Anthropology at the University of Edinburgh. She is collaborating with the Arts and Global Health Center Africa and the University of Malawi to launch the first medical humanities program and network of Malawian studies. So I'm going to hand over to Chisomo first, and then Angelique afterwards.
Yeah, thank you so much. Moses is unable to be here. Among other things, he is also in a region that has just been hit by Hurricane Ida. So I just wanted to send my well wishes to him and the entire region. I know that it's been quite devastating. But the reason, I've just put a link to Moses's work. Moses is a postdoctoral fellow, he's a PhD candidate at the University of Southern Mississippi, where he's doing some incredible work. He's a political scientist, he's a very prolific writer, he studies history and culture, and especially looking at LGBT human rights in Malawi. And it's actually in that vein that I just wanted to read a small snippet of his work, which I've also put in the comment box, because it forms a lot of the opinions that I'm going to be sharing in this discussion about the pleasure deficit and how the idea of enjoyment of sex has been wiped from the global sexual reproductive health agenda, but specifically how that affects African approaches to sex and sexuality and why that erasure is actually quite important. So in this piece that Moses wrote this year, he was reflecting on the first Pride Parade in Malawi and giving a bit of a socio-historical comment on gender and sexuality in Malawi. Now, there were other speakers earlier who spoke about this, about the kind of the washing away of traditions that was part of the colonial project. Malawi in itself was colonized by Scottish missionaries who felt that Africans needed to be reshaped and remodeled in the eyes of in the image of God, and that image was a white man. So there was so much of cultural erasure that happened, but specifically, we don't talk a lot about what that meant in terms of our views of relationships, gender, and all sorts of arrangements in society. So he writes here about narrative studies and ethnography about, in our communities when discussing gender. And the problem was when people say, when gender first came to Malawi in 1994, women did this, or gender in Malawi, these discussions of sexual pluralism don't really exist. They've all been eradicated, as if gender rights, gender studies are a new construction. And they're kind of seen as this kind of post-democratic, post-colonial thing as gender. So this is a really important essay that he wrote. I really hope that you have time to read it, because he focuses a lot on what gender means. So I'm just going to read about 3 paragraphs of this, because I think it's quite important, where he talks about the dangers of ahistorical conceptions about gender and sexuality in Malawi, in that they erase and deracinate local LGBTQ histories and frame gender and sexuality as alien or foreign, or often conflate gender and sexual pluralism with neocolonialism. and thus they enable attacks against LGBTQ people as foreign transplants rather than locally rooted and equally Malawian LGBT people that they are and that they have always been. He writes that in the process of homogenizing the dyadic heterosexual format in Malawi, it was mostly started by Christian missionary interventions, institutionalized by colonial administrations and legislations which were infused with racist pathologist views about African sexuality, and carried into the independent dispensation of political classist expressions of post-colonial African governing and economic elites, including civil society, public servants, and private sector professionals. Conversely, the same processes led to the marginalization and effective criminalization of more gender and sexually fluid cultural arrangements in Malawi, legacies of which persist to the present, as seen in lingering disparaging connotations against Eastern and Southern people in Malawi, particularly Yawo women and the Sena in the South. The dyadic format was a colonial class exemplar used to target matrilineal, matrifocal, and other gender sexual arrangements outside the prescribed male-centric one-partner system of the Christian Orthodoxy. So systems which were male-centric and patrilineal and patriloquial were deemed preferable to both missionary and colonial than post-colonial governance, when those were, this is an aside now, those are mostly in the northern regions of Malawi, compared to polyamorous systems as they were, which were mostly dominated in the central and southern regions, as they were much more amenable to the overall drive to reconstruct African social structures after the heteronormative bourgeois family template for the purpose of organizing labor for the colony and post-colony. Polygamy, because of its male-centric structure, was far less contested by the missionaries and colonial administration and the first post-colonial government than the gender systems, which were more female and women-centered. And I'll just add as an aside before I switch, is that these were mostly predominant, and as I said, in southern and central regions. So in this piece, which is really important to understanding this shift culturally in Malawi, which is largely matrilineal, that it was actually seen as an affront to Christian ideals to have a system of inheritance that was entirely determined by women. And as Moses correctly says, that it actually caused a lot of problems when they started seizing land, because they would bring in male laborers who would then leave to their wives' village when they got married. So it was very important for them to shift the cultural norms to patrilineal systems so that they could retain male labor. And I think it's quite important, we'll discuss this, and is how we don't really talk about these shifts anymore. We know them, but we don't factor them into our legislation, into our organization of health specifically, and how some of these discourses about gender and sexuality, which are still seen as valid in specific circles, and especially in rural areas, even though it's not open, but there's still areas of resistance where people protect this knowledge and really protect people who still abide by traditional systems of how gender should be organized. So with that, I thought I would turn over to Angelique, who might want to share some perspectives from South Africa before I continue, and then we can open up for some discussions. So Angelique, do you want to, yeah.
Sure. Thanks so much. So just thanks for the introduction, Nolwazi. To start, I'm going to just speak a bit about my experience in research and about my doctoral study. So in 2019, I'd registered for a course on gender and sexuality at the Department of Anthropology at the University of Cape Town. In this course, we were given the task to write blogs, reflecting on our readings, but also our own experiences on gender and sexuality. In one of these blogs, I'd written about how I was struck by how the foundational texts in my academic career have been authored by white men and women, when my history was lodged in the throats of women with brown and caramel and sometimes milky skin and freckles like mine. Part of this history is also sexual. A few years ago, I worked as a researcher as part of a social science team in an HIV trial. Here, my focus was on key population groups, which some people call vulnerable populations, which included trans people, young people, and sex workers. I spent extended periods of time visiting families, and by families, I mean more of a loose term to describe the networks of people within households, but also beyond. So I spent time on the streets, in brothels, and also in the homes of these women. Something that struck me was how sex workers redefined spaces of intimacy. They were selling sex, but they were personal parts of themselves that they kept private and at times sacred. This included hand-holding, and for some, even kissing was kept for their intimate romantic partners. I also remember coming back from the field after days spent with young people, and how sex was a tough topic to bring up. Young people shied away. It was taboo and almost forbidden. Sex was also not good. It was more about the male partner. I recall one man, for example, telling me in Afrikaans, "Ek het haar gestiek met my mes," which translates to, "I stabbed her with my knife." The knife was his penis, and the stabbing was sex. Sex was being done to and not with. Joy and pleasure was absent. In merging these experiences in my own doctoral study, I'm trying to understand sexual and reproductive health within intimate relationships that young women living with HIV have with their sexual and romantic partners. In this work, I am grappling with a risk-centered narrative that has become the norm. Sex is risky. And here I don't disagree, as there are multiple risks present within sexual relationships, but we are often only concerned about risk. The discourse is usually around fear, death, disease, and danger. Adolescent sex is often prescribed as deviant behavior, morally wrong, and socially problematic. The stigma attached to adolescent sex only continues to reinforce stigmatizing attitudes and shame that prevents adolescents from approaching sex healthily with all the tools and knowledge needed to ensure pleasurable, healthy, and protected sexual behavior. So adolescents and young people are having sex. This is a fact. For me, the narrative and approach needs to change. We need to think about sexual health as an approach that favors physical health, personal choice, and a positive and respectful approach to sexuality and sexual relationships. In 2014, Catherine Harden offered some insights on sex positivity, referring to a sex-positive approach as one that calls for acknowledgement that sex encompasses pleasure and can be rewarding, accepts sexual diversity and choice, and asserts that sex does not have to relate to procreation. However, this sex-positive approach also exists within a context, and this context, for South Africa at least, includes belief systems, cultures, gender norms, and power differences within relationships. But it is within this context that sex needs to be redefined, and while it is an incredibly tall task, it is a much needed action if we want young people and adults alike to see beyond risk and have good, healthy, and safe sex. I'll stop there, and I'm not sure if I hand over to Nolwazi or Chisomo.
Chisomo will go back. Yeah.
Yeah, I was busy tweeting what she just said. So you have to forgive me because it was just absolutely fire. Thank you so much, Angelique. What I was actually struck by is something that I was going to turn it back to my research a little bit. But I've just actually felt that I cannot lose the momentum that Angelique has just brought. One of the things that I noticed in my own research is that we seem to have developed a new vocabulary when discussing sex in Africa. It's no longer about pleasure. It's not just about reproduction and desire, the ability to extend your family, to continue generation and lineage and heritage and all of the things that I was taught about in my traditions from my grandparents. But the vocabulary of sex is almost entirely now shifted into the things that Angelique mentioned: fear, death, disease, and gender. And in doing so, the global health perception has reinforced the idea that all sex between or with Black people is dangerous and African people is dangerous. And I thought, as we kind of move into this discussion, is that it's important to analyze the ways that we have done this. Sometimes we think of it as inadvertent, sometimes we think of it as protective, as ways to shield African people from the harm of the colonial gaze, from the white gaze. But then also, I think that the vocabulary itself, especially in public health, has been very harmful in reinforcing that. One of the terms that I came across in my own research that I've never heard and I could be wrong, I really want people to correct me, when describing specific types of relationships such as polyamory, is they'll use in the African context concurrent partners as opposed to polyamorous. And I've always found this shift interesting, that when we're talking about people who have multiple partners, who share love and relationships with more than one person at one time, in every African public health journal, it is always concurrent, but in every other field, they'll admit that it's polyamorous. They'll talk about risky behaviors, and I don't want to undermine some of the risky behaviors that are associated with rituals, but any risky behavior seems to fall into African or Black understandings of sex and sexuality. This includes anything from ethical consent and things like BDSM or other sort of pleasure play, that it's never described as an act of consensual agreement between two people, but it's again reinforcing the idea that this is a risk and that we need to address the risk in a way that isn't ascribed to other communities. What I've always found interesting is that there is a clear delineation and clear demarcation between things that we discuss in the public health sector about sex and reproduction that really vastly different from the ways that traditional discourses have allowed us to maintain them. Now, those traditional discourses haven't been eradicated, but they are disrupted. They're continually disrupted. They exist on a different sphere. And I think about this quite often when we actually look at some of the ways and the words and the language we have in our own communities and cultures to describe specific practices, or even words as, when we're discussing gender, a very simple one. Many people here who speak an African language will notice that we don't have genders in our language. Usually the distinction is between elders and youth. And not to say that the language isn't gendered. We'll describe someone as the mother of or the father of, but that distinction isn't the identifier that has been imposed by other cultures on us. So in terms of that, I really wanted to discuss about the ways in which we can disrupt this and have a more organic and more truthful discussion about sex and gender, and more specifically, how we can begin to challenge that in a research setting, because I do believe from my own research that the new vocabulary of sex that has been used to describe Africa is reinforcing the four harms that Angelique so beautifully shared with us. So I was hoping that we can continue this discussion, and Nolwazi has some questions for us. I do know I'm really excited to get to it, but I think I'll just leave it there for now so we can get to it.
Thank you both, Chisomo and Angelique. Angelique and Chisomo, what's really exciting about what you're talking about, Angelique, your research really reminds me of something that Carla brought up earlier, which was the work that I did with some people around well sexuality, and that was working with young people and trying to find out how they think about sexuality, and specifically how their thoughts, their ideas, their experiences hinder or enable the uptake of sexual health interventions. And so some of that work involved the young people finding ways to express themselves, mainly visual ways. And we have an exhibition up, which is kind of ongoing on wellsexuality.com. And I'll put that on the chat. But what was really interesting is that it also arises from some work that I did in 2011, which was with a special issue for gender, which was looking at teenage ideas of desire and fertility. And this was something that was seen as lack because teenagers weren't supposed to have desire, they weren't supposed to have pleasure around sex. And well sexuality is almost kind of a continuation of ideas about youth and pleasure and sexuality. But what was very inspirational about well sexuality work is that at this present moment, social media and movements like Fees Must Fall have given young people a kind of new way of thinking about, of describing a kind of new vocabulary, which is what Chisomo is talking about. So what I'm seeing in contrast, Chisomo, or to what you're saying, is that I'm seeing young people finding a new way to express very positively their experiences of who they are and how they actually see the world. I'm also interested in changing the narrative around kind of reproduction in Africa that frame it primarily in terms of risk, of pathology, of mortality and irresponsibility. And instead, and this is a new project that I hope to be doing, which is called Doing Natality, Making Babies, Making Kin in Africa. And that is to look at approaches that are about longing, and they're about desire, and perhaps about joy, and what having children can bring, rather than, it's always very risky and they very high rates of fertility in Africa, and therefore we should find a way in order to curb fertility. Interestingly enough, what people do not also realize is that Africa, the continent, has, not the whole continent, but parts of Africa have some of the highest rates of infertility. And we never look at how people desire and long for children, and how medicine and other different kinds of interventions, vernacular and otherwise, can help with this longing, with this desire to have children and to do reproduction differently. And that's, I suppose, also what the concept of natality allows us to do, is to shift the kind of negative perception of reproduction. So my question to both of you is essentially, what, in your opinion, are the most important issues around research on sex and reproduction in the two countries that you've worked in? And also, a second question is really about how we can address the kind of stigma and shame that is associated with sex, especially, Angelique, for you, with young people engaging in sexual practices.
Sure. Angelique, do you want to start, or do you want me to jump in?
Either way is fine. Go ahead.
Okay, I'll be quick because there's just so much to say on this. For me, one of the key issues that I wanted to bring up is that we haven't really developed any specific platforms that have a sexual health and HIV or intervention system that models anything that actually discusses pleasure and actually coming forward with it, that centers pleasure in the way that places like 56 Dean Street, if you have time, Google them. They're a STI clinic in London that has a huge and wide community engagement. Now, community engagement is quite critical in the STI and sexual and health and reproductive work in Southern Africa. I don't want to say it doesn't exist, but it is entirely clinical on treatment and disease, and not necessarily approaching some of the issues that people have about how to enjoy sex, how to have sex safely. And also, I've heard some complaints largely across the continent about what Nolwazi was talking about, is kind of framing reproductive in terms of population control, and not necessarily the desire for people to expand their families and have families. And I think these are critical issues that we need to address quite rapidly, because I think right now the way there's a real danger in doing so is because it's compounding colonial narratives that Africans are only capable of reproducing and having sex. And when I say that, I'm actually pointing to actual texts from colonial administrators who did believe that the African mind was physically smaller. It was part of, pseudoscience, Victorian pseudoscience, and that because the African brain was smaller, there was more orientation towards sexual desire in the genitals. And we haven't built a health model that actually deviates much from this. It's actually quite incredible in that sense of preventing this kind of exploration or discussion of sex and sexual health and pleasure. So I think that's a real critical flaw that needs to be addressed, in the sense of exploring the colonial harms that came from this model of medicine and reversing it so that we can actually have an impactful sexual and reproductive health system that isn't based on racist colonial science.
Just to add, I actually wanted to touch on what Nolwazi said about children. Actually, some of the work that we've done on the adolescent, we had an adolescent parent questionnaire, and we found that young mothers were speaking about how their children they were giving them joy. We asked them about the things that made them smile, and they would speak about how their kids would dance around and they'd make little faces and all the stuff. And I think that that is something that's missing from the discourse around that actually, yes, there's mortality and all of the bad things that come with it, but there's also the beauty of parenthood, whether that's young motherhood as well, and the good things that come with that. And then I also wanted to touch on what Nolwazi said about digital spaces and how young people are making their voice heard. And you spoke about fees must fall. I also think that young people are demanding more open and honest and explicit information around sex, and we need to be thinking about where do we want them to get it from, because they can get it on the dark net and the internet. And then we also know that porn reinforces dangerous stereotypes around gender and race and body image as well. So we need to be thinking about how do we engage with young people and open up these discussions so that they don't find it in places that are actually more harmful than good for them. But then to go back to your question, Nolwazi, on you were talking about the most important issues in sex and reproduction in Africa. I think an important question to ask is who leads that research, firstly. Is it Africans leading research on Africa and the issues in Africa? For me, that's quite a central thing that we need to be thinking about. And then also sexual and reproductive rights. Who decides who has those rights and who gets those rights is something we also need to be talking about. But then also, and I think in the context of COVID-19 especially, what's really important right now is to think about, I guess a lot of the world seems to be on pause with COVID, but sex and reproductive health doesn't stop. There's no, it still needs to be dealt with, it still needs to be responded to. So thinking about that and how the disruption in those services have happened is really important. And then lastly, I wanted to touch on the shame and stigma that you spoke about. I guess for me, there's 3 parts to it. I think of it almost in the same way that I think a bit about resilience, thinking internally, relationally, and then institutionally. And what I mean by that is thinking stigma and how we think about sex needs to change in our own minds and our own thinking. But then it also needs to be changing within relationships and how we engage with others and have conversations like this one about sex. But then also institutionally, what I mean by that is in clinics, for example, how are healthcare workers speaking to young people about sex? And thinking about their own beliefs and their own understandings and perspectives on sex and what is okay. And so we also need to be developing a sort of agency and self-esteem for young people to be able to come to those spaces and engage on these topics.
Angelique, I mean, absolutely wonderful and true in the sense where the shame and the stigma, you had shared something in our conversation about some specific context of that in Afrikaans language in Cape Town of how the young kids describe from you. Do you remember those words that you used? It was like coke or something, or?
Yes, so Chisomo and I was speaking on Monday, I think it was, and there's a word in Afrikaans called koek, and there's a word called tart, which translates to a cake and a tart. And there's this narrative around how if you are conservative and decent, and I say that in inverted commas, then you are a koek. But if you sleep around, you are a tart. And so these terms and these phrases that follow young people around and basically frame who you need to be and how you need to be in the world related to sex is basically what we were speaking about. I hope that's a good enough explanation, Chisomo.
No, absolutely. And I think it's just the powerful words of how slang just kind of compartmentalizes us to who's a decent person and who's an indecent person. And that's continuing this trajectory of this, what we're saying about prescribing these roles. And I know that these occur elsewhere in other cultures, this kind of shaming and sexual stigma. But as your work shows, that we're also dealing with coming this in I hate to say the word post-AIDS because we're nowhere near post-AIDS yet. But, this kind of method that we have been using this vocabulary to further scare people out of having sex in order to stop an epidemic. And we've seen that if we compare that to the emergence of the gay men's health crisis in the United States in 1982, that the same tactics were used. It was kind of looking at AIDS as a prophecy of what happens when you're immoral. And that we have had to work ourselves out of that stigma as well. Now, the one thing which I'll say before I open up to questions, going back to Nolwazi's question, is I am absolutely mystified why there is a specific slogan that's being shouted across the global north that we don't hear a peep out of in Africa. And that is you equals you. Undetectable equals untransmittable. I've heard this from specific NGO. I know that Art Glow, who is here, and they'll be speaking about this tomorrow more. They'll be speaking tomorrow, has also done some work on this. But in terms of a national public message that if you're undetectable, you're untransmittable, because it's going to be seen as you're promoting sex. And it's something that has really held back the progress in our HIV and AIDS of not bringing this message forward as equally as it should be. And it feels like it's going to harm in the long run because people don't realize that it's so important for them to keep their viral loads undetectable through medicine. So I think I'll leave it at that, and we can maybe have a discussion around why it's not being shouted over the mountaintops.
Okay, thank you both, Angelique and Chisomo. Are there any questions for the two speakers? So we have about 8 minutes left. I kind of would like to comment a little bit and hear your thoughts about sexual education or sex in education. And the reason I ask this because I've worked with on two projects. One was in South Africa with the sexuality education curriculum of the Department of Health and the Department of Basic Education. And the other was in Botswana with a youth-led, youth-based organization called Young Love. And it was interesting because the first intervention that Young Love had, which was supported by the Department of Health and Education in Botswana, was going to schools and giving a program called No Sugar. And that was around the issue of intergenerational sex. And they were trying to get young people to realize that the riskiness of that. So don't have sex with sugar daddies, in a sense. And what was interesting is that this particular intervention, they were quite responsive. And in realizing that it wasn't working, they came up with a new intervention, which is called zones. And the idea behind zones was that stick within your zone, have relations with people who are your age mates, such. It wasn't do not have sex, but it was have sex with people who are your age mates. And so I was very interested in the response and the responsiveness of this intervention. And in the South African research on the sexuality education curriculum, what we found out, which was really surprising, was because there's always a narrative that parents or adults, which are both parents and teachers, shy away from or opposed to sexuality education in schools. And what we found was that this was not the case, as much as the media tries to portray it this way. And instead, parents found that and supported the sexuality education curriculum because they saw themselves as being able to give what is kind of a moral education, but they were ill-equipped to give the kind of more practical and technical aspects of it. They did not know so much about contraceptive use and about the side effects of contraceptives. So it was really interesting because what we are hearing, especially in South Africa in the media, is that there's this great opposition, especially among kind of Black families, for sexuality education in schools. So I would just, in a sense, like to hear your thoughts about sexuality education and approaches to sex in education, which Chisomo, you started touching on earlier. But I see also Carla has a question. Shall we just take that quickly as well before both of you respond?
Sure.
Hi, thank you very much. Thank you both for that input, and Nolwazi for your insights and perceptions and kind of widening the discussions to think through all these spaces. I had a comment on I think what Angelique and Chisomo are about to touch on now, which is in terms of specifically sex positive education. So in health sciences, I mean, this has been one of the key concerns, is that, you know, we train healthcare professionals to go out and address backaches or, you know, young people's experiences or different types of ill health associated with sexual reproductive health, but very seldom do we use a sex positive approach, or do we speak about the joy or delight of sex. And when we started trying to talk about this in the curriculum, it became a very interesting thing. So on one hand, there's sometimes lectures where students will walk out because any discussion of sex or sexuality and anything outside of a very often either traditionally in the loosest sense or religiously conservative bound idea of sexuality is just not listened to. So it's just removed. So people will physically remove themselves from lectures. Not many people, but a few. But the converse to that also is though that it's partly, you know, Angelique, you spoke about sex workers opening on space. Nolwazi, you spoke about, you know, parents wanting conversations that they can't necessarily have. And the other thing that comes out of it is, in fact, this great desire of people to talk about the joys of sex, because, you know, an orgasm is good, an orgasm is fun if it's consensual, if it's yours, there's joyful things there. But what we see mostly and predominantly are these particular hegemonic narratives, and they have these long colonial trajectories. And what I was interested to hear from everybody is, Nolwazi, you've touched on this, but perhaps Chisomo and Angelique, is the things that I'm always intrigued in are those counter narratives, the non-hegemonic responses. So in the 80s, you know, when all the like AIDS is going to kill gay men because it's a punishment from God, you also had these quite radical, I mean, in the South African context, quite radical pictures of gay men naked, and, you know, obviously not slightly flouting the pornography laws of the time. So they were kind of borderline, you know, couldn't disseminate the information. But you had organizations, groups of people saying, well, you know, actually that's the narrative that way, but we're making this new thing. So I'm kind of intrigued if there are other examples that you had of where these kinds of counter narratives are happening. I'm thinking a few years ago, I think it was around 2012, there was the predominantly Zulu language website that had discussions and short stories and erotic fiction on it, and, you know, kind of got overlooked a bit because it wasn't deemed kind of newsworthy, and yet was this really interesting space. So I just wondered about where are the spaces for those counter narratives, for those sex positive things? Where have you seen them? Where have you come across them? Thanks.
Twitter. I have definitely seen a lot more openness. I think it's really incredible to talk about counter narrative, but even, you know, we always talk about Malawi as being very religious and conservative, but I always say that religious influence, especially with HIV and AIDS, you know, with the abstinence, be faithful and condomize only narrative, that is the official narrative because the government will step in and override the church. But I've always found that the people, that influence over the people is not as strong. So religion has more influence over politics than it does over society. And so for me, the resistance I've seen is just Malawians being open and saying, here, I've opened up a sex store and here's my link to my Twitter profile. And within a week, 9,000 people are following the sex store, you know, and no one says anything in Malawi because it's kind of like, okay. And it's just kind of this quiet resistance of when the people decide that they're going to be open and sexual, then people go with it. I just wanted to bring in Helen for a minute because I know that Helen has done quite a lot of work in this. Helen, are you there?
Yes, I am here. Yeah, I guess for us, it always feels like a really tricky space to be in, especially like doing work with young people at a community level. We do quite often get pushback that like as soon as you're openly talking about sex, not in the context of just like abstinence, then you're encouraging young people to have sex. And I've also noticed, I don't know, quite a bit of often some reticence for young people to want to talk more about the pleasurable side of sex. Even university students, like they would be very confident to act out a scenario around like sexual abuse or like a feces coming for a young girl or something like that, but trying to like do a theatre scene around a more like positive sexual encounter is something people often seem to find quite uncomfortable. So yeah, I agree there is there's that space like within Twitter, but that's not necessarily a representative portion of the population. That's your kind of online group. And then, yeah, I guess it just depends really a lot on the community, etc. But it often feels like a really tricky territory to be going into, like how to have those conversations without looking like you're just telling young people like, out you go, off you go and have sex.
Thank you, Helen and Carla, for your questions and comments. I'm going to go back to Angelique. Would you like to comment on what's been said?
Sure.
I was just thinking about Carla's question and thinking about, you know, stories that do come out. And sadly, I guess in the research that I've done, I can't think of many stories where sex was good. A lot of young women especially would speak about how they weren't having pleasure, how they weren't having orgasms. Or I remember, for example, one young woman, she spoke about how her boyfriend would just rip her underwear off when he wanted to have sex. It was quite intense. And the only example in my mind that I can think of was one sex worker actually, who she was homosexual, but she was having, her clients were all men, but she had a relationship, an intimate relationship as a lesbian. And that was the one space where she found pleasure. And she wasn't shy to speak about how they were having great sex, actually. But that's the only single example I can think of, which is quite hard. Yeah, and then when I wanted to dive into something on the sex education, I wanted to read something from the Department of Basic Education's website, actually. It says, the focus of the South African curriculum is not on sexual pleasure, but on prevention of HIV, STIs, early and unintended pregnancy, healthy lifestyle choices, and avoidance of risky behaviors. And I think that in itself is problematic. Because it is focused just on a risk in that in itself. And so something I also wanted to touch on, I think Carla spoke about teachers. And before we can even get teachers to speak to young people, they themselves need to be able to talk about sex in order to speak to students about sex. And that's something that we need to think about, but also giving true historical accounts of African sexuality. I mean, yes, there of course are the negatives, and I'm thinking around apartheid and the state machineries organizing human relationships, and I'm thinking about Saartjie Baartman as well. But then there's also the positive. We have in our history recorded ideas on eroticism, which goes back to ancient civilizations in the Nile. And I mean, we have those things, they do exist. We should be telling young people about the history that is not just negative, but that portrays sexuality in a positive light as well. Yes, that's just some of what I wanted to add.
I'll just say very quickly before we go, I think we're a bit over time. It's time for a bit of a tea break. But it's, you know, just following what Angelique said, yeah, we'll have an increased presence of people on social media who do stuff differently, but there's always been an indigenous resistance. Even right now in rural Malawi, there's spaces where people are absolutely living their lives. And if you put a pride flag on a hotel in Blantyre, you'd have the whole country erupting. But there are spaces all over the countries where people are protected, people have their own spaces, and everyone knows what happens in these spaces. And people just go on resisting because they're living in the way that they don't see as any different from ways of were practiced in their ancestral past. And that has always existed and will never go away. So I think for there, I just wanted to maybe turn over to Nolwazi.
Okay, thank you both, Angelique and Chisomo.